So the second component the pens are a little bit faint, so pardon me. It's going to be business knowledge. You're going to need to know about the business of dentistry, which this whole seminar is about. I would say dentistry is a professional business because you're going to need to know about the logistics, the legalities, the legislation, as well as trying to find a location for your practice. You're going to need to know about a lot of stuff. You're going to need to know about employment law. You're going to need to know about corporate law. You're going to need to know about CQC inspections at the very least. I know very many skilled practitioners who are having problems with their CQC inspections, and they're really sweating it because they don't have an idea what those CQC inspections are about. So it's a wise idea to really get involved in these things at this moment in time in your career if you're undergraduates, and most of you are. So you're going to need to know about very many technicalities which you're not taught at dental school. You're going to need to know about selling, about sales, about marketing of your business. You're going to need to know about branding. As Dr. Leah said earlier, there are challenges in opening your practice. You're going to need to be prepared for them, and it's wisdom to do that now, early on in your career. What you're being taught here at university, believe it or not, your crowns, your root canals, your fillings, your bridges, your whitenings, these are all products. And if you step back and look at it from a consumer point of view, you're going to need to know how to convert your product, service, idea or vision in a way that the patient or the consumer or the client turns around to you and says, "Thank you, doc, I'll take that off you, where do I sign?" And that's going to boil down to your communication and your care. Ultimately, we're a caring profession, and ultimately you need to have care as a basis of everything you do for your patients. Otherwise, you lose your patients and you lose your practice, and you don't want to go down that road. Am I making sense? Yes? So you need to have that as a basis. You need to have care for your patients.